Hi, I'm Sydne Skaer. I'm a family nurse practitioner at Benefis Women's and Children's Center. I'm a Great Falls native and I love taking care of women of all ages. That's a great question. Fibroids can impact fertility, but we do imaging to evaluate first what type of fibroid, and then if needed, we send you on to one of our gynecologic surgeons who would take care of it via surgery. Diet is something that impacts our health in every avenue, including fertility. And recent studies have done a review of what benefits fertility the most. There are certain supplements and types of diet that can improve your chance of fertility, and that includes things like vitamin D, vitamin B12, and a Mediterranean diet. We know that things that impact our health badly, whether it's for fertility or anything else, includes trans fats, a diet high in red meat, sugars, sweeteners, and things of that nature. So we really encourage our patients, male and female, to follow a healthy diet that's low in sugar, low in trans fat, low in red meat.
Hi, my name is Jaimee Gregoire, and I'm a family nurse practitioner at Benefis Women's and Children's Center, and I specialize in both women and children. However, I've taken a special interest in fertility. I think to answer the question about how long you should have been trying to conceive before seeking treatment with one of the three of us is kind of an open-ended question and individualized to every single patient's care. So I think if you have questions, concerns, or just want some preconceptual counseling, we encourage you to reach out and we can kind of help guide you from there. When it comes to PCOS, otherwise known as polycystic ovarian syndrome, it can be a very complex disease. And so I think the first step is coming and seeking care and seeing if we can get some of the steps started to see if you are one of 10, and they think actually up to 2 in every 10 women actually struggle from this condition. PCOS is the #1 leading cause for infertility, and so we definitely take a deep look into everyone's personal and family history to see if you are possibly someone who struggles from that condition. So we start with some basic laboratory work. We do an in-depth family history as well as personal history, and then do some diagnostic imaging as well to see if maybe that's one of the things that's possibly impacting your fertility.
Hi, my name is Kelly Timmer. I'm a women's health and family nurse practitioner. I've been in Great Falls for over 30 years, and early on in my career, I became very passionate about fertility services to all of Montana. Once a girl has been 2 years into her menarche or her period starting, it's not normal in most circumstances to not have periods or to have irregular periods. So in that case, we would encourage anybody to come see us if they're having irregular periods. There's a lot of implications and etiologies that cause the irregular periods, but yes, they can affect fertility in many ways, whether it's from thyroid or whether it's from PCOS or prolactin levels. There's just so many reasons, and everybody's so individual. If you're having irregular periods, please come and talk to us, and we'll figure out what's going on and help sort things out, whether you're trying to get pregnant or not. Our fertility team at Benefis is very excited about the Women's and Children's Center, especially because we have our own service line now for fertility. We're going to be offering 24/7, 365 care for all individuals in our community and throughout Montana.
At Benefis Women's and Children's Center, although it is geared towards women and children, with fertility we still address male factor because it can affect up to 1/3 of cases of fertility. And so we do evaluate male partners and offer comprehensive services for them as well.
One of the new and exciting things that we have to offer at our new Benefis Women's and Children's Center is a new call system that works for our fertility patients that allows them access to us 24 hours a day.
7 days a week.
365 days a year, so please reach out to us at 731-8888, Benefis Fertility Team.